Dear students, welcome back. In the previous session, we have seen the structures of radiocarpal joint as well as the mid-carpal joint. These two joints comes under the wrist complex. Now, in this session, we are going to see the ligaments of the wrist complex as a whole. Before studying this ligaments as a whole, we have studied the ligaments of a wrist joint separately in the case of anatomy. So first we are going to refresh that points, and then we are going to study these ligaments based upon this biomechanical aspect. So here in anatomy we have studied that the wrist joint is surrounded by a capsule and it is having ligaments on the palmar aspect as well as the dorsal aspect. The palmar aspect, it is having radiocarpal ligament as well as the ulnocarpal ligament. Here this one is the radiocarpal ligament and this one is ulnocarpal ligament. And the same way dorsal side also it is having a radiocarpal ligament which is almost same as that of the palmar radiocarpal ligament. Okay, and it is also having some lateral ligament and the medial ligament of this wrist joint. The lateral ligament forms the radial ulnar collateral ligament, which runs from the radius to the scaphoid as well as the trapezium, and then the ulnar collateral ligament forms the medial ligament of the wrist joint, which runs from the ulnar to the triquetrum and the pisiform bones. So these are the major ligaments which surrounds the wrist joint. When you come to this mid-carpal joints, so this mid-carpal joint is the joint between the proximal row of the carpals and the distal row of the carpals. So here many bones are involving here, and this joint is surrounded by a fibrous capsule which is very thin and irregular, and some parts of the capsule are thickened and form the ligaments here. So the capsule itself thickened and forms the palmar and dorsal intercarpal ligaments. That means from each bone to bone. So for example, if you take the proximal row, scaphoid, lunate and the triquetrum, so intercarpal ligaments are nothing but, so for scaphoid to lunate you'll have one ligament, from lunate to triquetrum you'll have the other ligaments. So the same way which is seen on the dorsal row of bones also. So these are nothing but the palmar and dorsal intercarpal ligaments, and it is also connecting the bones of proximal row to the distal row. Okay, so for example, if it is scaphoid in the proximal row and it is going to connect with the capitate in the distal row like that. So these are also connecting from proximal row to the distal row. So if you see these such kind of ligaments, so one way or the other way, the ligaments which are attached from the wrist complex, that is from the wrist joint, is one way or other way is attached to the mid-carpal joint. So there is a very close relationship of these attachments of these ligaments. So we are going to study these ligaments, the whole ligaments which are which we have studied separately in the previous sessions. Now we are going to study all these ligaments at a time as a wrist complex. Okay, So mainly because of the close approximation of attachments of these ligaments. Okay, so there are number of studies have studied based upon this ligaments of the wrist complex. Finally they have concluded that this is a very complex structure because of its attachments. Okay, and also they have found that there is an tremendous individual differences that exist in the structure of this corpus. Corpus is nothing but the wrist complex. Okay, this such kind of differences can be clearly seen from person to person. Okay, next, this ligamentous structure of the wrist complex or corpus is responsible not only for articular stability but also for guiding and checking motion between and among the carpals. Okay, so these ligamentous structures of this wrist complex is responsible not only for articular stability but also it is used for guiding and checking motion between the carpals and among the carpals. Okay, so for this the ligaments we have seen here are it is having ligaments on the dorsal aspect as well as the ligaments on the volar aspect. Volar is nothing but the palmar aspect. So the ligaments which are present on the volar side are numerous. That means many volar ligaments are present on the volar aspect and these are thicker and stronger. When you see this dorsal side, so these are the dorsal radiocarpal ligament you can see here. The dorsal wrist ligaments are described as thin, whereas the volar ligaments are thicker and stronger, and the volar ligaments are numerous when compared to the dorsal aspect. Okay, and the ligaments of the wrist complex here in biomechanics it is designated either extrinsic or intrinsic muscles. So the intrinsic ligaments. So the extrinsic ligaments are those that connect the carpals of the radius. So it is going to connect the carpals to the radius or ulna proximally or the metacarpals distally. So up to this metacarpals these ligaments are attached. So from carpals to radius and ulna proximally and distally from carpals to the metacarpals these ligaments are going to attach. What ligaments? Extrinsic ligaments. When you see the intrinsic ligaments are those that can interconnect the carpals themselves. So if you take here you'll have the scaphoid, lunate and triquetrum. So the ligaments which are attached here are so such kind of attachments that is called as intercarpal or interosseous ligaments. These are interconnecting carpals. Okay, now another studies done by Novak and Logan found the intrinsic ligaments to be stronger and less stiff than the extrinsic ligaments. Okay, that means what? Here, though it may be dorsal ligaments as well as the palmar ligaments, in that it is divided into extrinsic and intrinsic. Out of these extrinsic and intrinsic ligaments, the intrinsic ligaments are stronger and less stiff than the extrinsic ligaments. And this intrinsic ligaments which lie within the synovial lining. So that means these ligaments are present inside the capsule itself, and therefore they must rely on the synovial fluid for their nutrition. Whereas this extrinsic ligaments will have vascular supply. Okay, so these extrinsic ligaments are very likely to affect, but it is also having better potential for healing because it is having better vascular supply. And this extrinsic ligaments also help to protect the intrinsic ligaments and help them to heal this intrinsic ligaments if they are affected by accepting the forces first. So whatever the forces which are coming to this wrist complex, the forces are accepted by the extrinsic ligaments and then the intrinsic ligaments. Okay, so this is about the ligaments of the wrist complex. In the biomechanical way, these ligaments are present both volar side as well as the dorsal side, and these ligaments are divided into extrinsic and intrinsic on both the sides. So this intrinsic ligaments are intercarpal ligaments, whereas these extrinsic ligaments are connected from carpals to radius and ulna proximally and distally to the metacarpals. Okay, now we will see this ligaments, volar carpal ligaments and dorsal carpal ligaments. So now coming to this volar carpal ligaments, these ligaments which are present in the volar side are, the major ligament is the volar radiocarpal ligament, or it is also called as palmar radiocarpal ligament, and it is having 3 distinct bands. So this ligament is having 3 distinct bands. One is the radioscaphocapitate. So here you can see this one, radioscaphocapitate. It is also called as a radiocapitate ligament. And another band is radiolunate. You can call it as radiolunate, which is short and long. So radiolunate ligament. So this one is radiolunate ligament. This is the lunate bone here. So radiolunate ligament. And another ligament is called as radioscapholunate ligament. So another ligament which is attached to the radius scaphoid as well as the lunate ligaments. This radiolunate ligament is also called as radioulnotriquetral ligament. Okay, and also radioscapholunate ligament. So totally it is having 3 bands. One is the main band, that is the radioscaphocapitate ligament. It is also called as radiocapitate ligament. And next one is the radiolunate. It is also called as radiolunate lunotriquetral, and the third one is called as radioscapholunate. That means it is connected to the radius scaphoid as well as the lunate. So these are the three bands present in it. Okay, the radioscapholunate ligament is the most important stabilizer. Radioscapholunate ligament is the most important stabilizer of the proximal pole of the scaphoid. And disruption of this ligament may lead to scaphoid instability. So if this ligament is affected, which leads to scaphoid instability. Okay. And also the current research reveals that the structure offers little support to the joint but acts as a channel for neurovascularity to the scapholunate joint. And coming to the radial collateral ligament, here you can see this radial collateral ligament. This radial collateral ligament may be considered an extension of the volar radiocarpal ligament and capsule. And Novak and Logan investigators identified the radiocapitate as an extrinsic ligament, whereas Blevins and colleagues identified it is a part of Palmar intracapsular ligaments. So some of the studies revealed that this radioscapho or radiocapitate ligament is identified as extrinsic as well as the intrinsic ligament. Now this is about this radiocarpal ligaments which are present on the volar aspect. Now coming to the ulnocarpal ligament complex, which is composed of mainly same, which is attached, which is including triangular fibrocartilage complex we have studied earlier, which includes the articular disc as well as the meniscus homologue, and also ulnolunate ligament. One is the ulnolunate ligament. Here you can see this ulnolunate ligament, and also ulnar collateral ligament. Here you can see this ulnar collateral ligament here. So these are the two ligaments, ulnolunate ligament and ulnar collateral ligament. Okay, these are the extrinsic ligaments, and two volar intrinsic ligaments are also present here. And in this, the first one is scapholunate interosseous ligament. Scapholunate interosseous ligament, which is also having an important function, that is maintaining of scaphoid stability. Okay, and another intrinsic muscle is the lunotriquetral. So here you can find this lunotriquetral. So this one is lunotriquetral. This is another intrinsic ligament. So which is also helps in the maintenance of the stability between the lunate and the triquetrum. Any injury to this ligament may lead to lunate instability. Okay. So, however, all these ligaments finally are going to stretch in the wrist extension. So these ligaments are going to stretch in wrist extension. Now coming to the dorsal carpal ligaments, dorsally the major ligament is the dorsal radiocarpal ligament. So this one is the dorsal radiocarpal ligament, which is same as the palmar radiocarpal ligament, but it is having some obliquity when compared to this palmar radiocarpal ligament. Okay, so this ligaments mainly helps to offset the sliding of the proximal carpal condyle on the inclined radius. Okay, so this is the important function of the dorsal radiocarpal ligament, and a second dorsal ligament is the dorsal intercarpal ligament. This one is the dorsal intercarpal ligament, which courses horizontally from triquetrum to the lunate. From the triquetrum to the lunate, and then scaphoid and trapezium, Okay, the two dorsal ligaments together form a horizontal V. So these two ligaments, the dorsal radiocarpal ligament and dorsal intercarpal ligament, forms a horizontal V shape, which mainly contributes the radiocarpal stability. It is mainly helps in the radiocarpal stability on the dorsal aspect, and also it is helping this wrist complex by stabilizing the scaphoid, mainly the scaphoid, during the wrist range of motion. The dorsal wrist ligaments are becoming taut with wrist flexion. That means these are going to stretch in wrist flexion. Okay, these are all about the ligaments of the wrist complex. In the next session, we are going to see the function of the wrist complex. Thank you.